Questions are being raised tonight about how health officials handled a patient at Grace Hospital who allegedly assaulted a nurse. CTV's Taylor Brock joins us now live with more on this. Taylor, what exactly happened here?
Well, Marilee, we don't know the details of the alleged assault itself, only that it happened March 26, and we know management at the Grace responded by having the patient seen by a doctor sooner. That drew the attention of the Manitoba Nurses Union, which wrote on social media that it's sending the wrong message by seemingly rewarding abusive behavior. The Progressive Conservatives health critic, Kathleen Cook, echoed that statement.
And unfortunately, the response in that situation was to fast track that patient's care, presumably to get them out of the ER as quickly as possible, which I think sends a terrible message to frontline healthcare workers and a terrible message to law-abiding patients who are waiting hours longer than they were at this time last year, that a patient who is violent can cut them in line. I think that's deplorable.
In response to questions, a spokesperson for the Winnipeg Regional Health Authority says they still have a legal and ethical duty to provide care to those in need. The ad, quote, as part of a balancing act to ensure the safety of staff and others in our facilities. A process is being used to ensure some patients who are known to have aggressive behavior are provided care in a way that limits the amount of time they spend in our facilities while receiving the appropriate level of care for their medical needs.
Taylor, were police involved in this incident?
Well, Marilee, the WRHA says police were called in and the victim was offered supports. We have reached out to the Winnipeg Police Service to confirm if any charges were laid. We are still waiting to hear back.